Digital technology is bringing consistent clinical insight and predictability to complex implant procedures. With 3Shape's Implant Studio, you have the tools needed to achieve predictable and aesthetic results based on prosthetic-driven implant planning. Implant Studio enables a flexible digital workflow that can enhance the patient experience and reduce chair time. Let's take a closer look at the Implant Studio workflow. When you have created your case in Implant Studio, you start by defining the content of the order on the 3D order form. In this case, the patient needs implants to replace 2 mandibular molars, so they are selected on the 3D model, as well as implant planning and surgical guide. You can easily change the specified indications later in your workflow by going back to this step. You can also plan full edentulous treatments in Implant Studio. The combination of surface scans from Trios and CB/CT scans in Implant Studio gives you very precise clinical insight that is essential when you want to carry out predictable implant treatments, leading to the preferred outcome for the patient. Implant Studio is an open system, which means you can work on any STL or DICOM file inside Implant Studio. With Implant Studio, the workflow allows you to prosthetically plan your implants. You can design virtual crowns or virtual wax-ups, and then later use the design as your prosthetic reference when you plan the implant treatment. There's a range of tools available to adjust position, shape, and anatomy of your designs. Common for all of them is that they are simple to use and quickly lets you achieve a result good enough to be used during the implant planning. Once you have designed the virtual crowns, you can continue with reviewing your CT scan and aligning it to the surface scan. The software can handle the alignment based on identification of 3 common points on the 2 scans. You can always change the alignment manually. When you are working on the lower jaw, you will also be able to define the mandibular nerve. A clearly defined nerve helps you realize the best possible way to plan your treatments while taking the necessary precautions. This is just one of the features in Implant Studio that can help you place implants safely. Once your scans are aligned and the nerve is defined, you can proceed to the implant planning step. Start by choosing the implant you want to use from the Implant Library menu. You have more than 50 libraries available in Implant Studio, and more are added continuously. When you have selected your implant system and size, the implant will automatically be placed based on the virtual crown you designed earlier. You can then manually adjust the placement if needed. When the implants are in place, you can move on to design the surgical guide. A surgical guide helps you achieve predictable results and transfers all your safety considerations into the surgery. In Implant Studio, you can design the guide to match your preference by using very user-friendly tools. The surface scan provides you with high accuracy and all the details of the clinical situation, which should be taken into consideration when designing the surgical guide. You finish your workflow by reviewing the surgical report and approving the case. From here, you can send the case to your preferred partner for guide manufacturing and/or further design. The guide is generated in an open STL format that can be 3D printed or milled, so you are free to choose the partner you prefer. This concludes our demo of prosthetic-driven implant planning and guide design in Implant Studio. For more information, please visit www.3shape.com implantology. Thank you for watching.